Because schools are offer both the social and physical environments for students and for their safety and well-being, there have been historical roots in the partnerships between educational health. And in order for Healthy People 2020 to succeed and for education to succeed, as Claire mentioned, a multi-sectoral approach is definitely necessary, with each playing key roles as we move forward. Next slide, please. It's important to understand the connection between the health and education goals when planning strategies to achieve Healthy People 2020 indicators. And I'll offer some strategies today that have been successful in ASCD's experience bringing schools, local health practitioners, and public health agencies together to achieve common goals. Next slide. Before going into that right now, I do want to give you a little background about ASCD because we are an education association and not always known to the public health environment. I'll talk a little bit about why we participated in the Adolescent Health Work Group. We're an education membership association. We were founded in 1943 as the Association for Supervision and Curriculum Development. We're unique among education associations because our members span all the professions in education, and we also work across the globe. The majority of superintendents and principals, school administrators in the United States, as well as researchers, local and state education policymakers, and others are members of ASCD. Since 2001, we've been in the forefront of education, partnering across the sectors to focus on educating the whole child, which includes adolescents. Through the whole child work, we partner with others to ensure that each student is healthy, safe, engaged, supported, and challenged with the goal of an educated, healthy, productive citizenry who are prepared for life in this century and all that that brings. From that, you can understand why we were very involved with the Adolescent Health Work Group and feel, as an association, committed to the achievement of these objectives. ASCD will work with our members, continue to work with our members, to influence the political will as well as the practice in the field that Trina and Claire have mentioned being so necessary if the Healthy People 2020 goals are to be achieved. Next slide, please. As two sectors focused on positive outcomes for adolescent and young adults, we know how important it is for society for education and health to work together. The consequences of low education levels and low skill levels impact the individual, the community, and society as a whole. As you can see from the slide, it mentions that 75% of students have graduated on time, only 75%. But I will tell you that in some communities, this is only 50% of our students do graduate on time, and in some communities it's even lower. The risk factors for dropping out of school are those that Trina and Claire both discussed: high rates of absenteeism, low levels of school engagement. There's no question in education research that student engagement is an important piece of a student staying in school, and interviews with students over and over about why they dropped out talk about school engagement being a big factor. Schools that have low achievement scores are also a risk factor for students dropping out. And of course, if students feel harassed or unsafe, they tend to have a higher rate of absenteeism. Next slide, please. These low education and skill levels are all associated with poor health and mental health status and higher levels of poverty and incarceration. So we need to look at higher educational attainment in order to ensure that there are healthy, safe outcomes for our citizens. Next slide, please. With on-time graduation rate being so important in Healthy People 2020, we need to look at schools not being solely responsible for education, and public health cannot be responsible alone for health achievements. So there's a lot of work to be done in order to bring these two groups together, and we've been working together on a national level and also on a local level to bring together the communities and schools so that they can address these needs. In a 2010 national survey of local health departments, however, we can see that there's quite a bit of work that still needs to be done and lots of room for forming partnerships between education and health agencies. Next slide, please. In working with schools to bring education and health together, we have seen this as there's a graphic that should come up with a little bit more clicking, Hillary, about the connection between education and health. And most frequently, education sees itself as sitting within the community completely responsible for education and putting health off to the side, off to the periphery, working with health only when absolutely necessary. That still tends to be the most common relationship we see. And even though during the H1N1 outbreak, there was more connection between health and education agencies, those partnerships have often been one-time events and not necessarily developed over time. We also sometimes hear from health agencies that schools are places that have lots of arms that can be inoculated. And I know I'm generalizing, but with our experience, the data we saw on a previous slide also shows that that's often the case, that the percentage of health departments and schools that work together is fairly minimal. Next slide, please. So with Healthy People 2020, in education, we're hoping that we can bring schools to see a shift to a more holistic view, and also public health bringing a holistic view to the table also. A focus on the education of students under IDEA, on reading and math skills, on graduation rate, and other education-related indicators that Trina outlined. This brings a prime opportunity for health to become the foundation of a holistic or ecological approach to education within the context of the school and the community.